Hi, my name is Kim. I'm here with Kim and Kristen, and we're going to present anticipatory guidance for school age 5 through 12-year-olds. I'm going to talk about physical growth and development. In these children, you should encourage them to eat fruits and vegetables, whole grains, 3+ servings of low-fat dairy daily. They need to maintain adequate intake of daily calcium. For children age 4 to 8, they need 2 cups of low-fat milk per day. You want to include the child in participation of meal planning, shopping, and preparation. So when you're at a grocery, that's a great time to introduce them to different types of fruits and vegetables and let them pick out some of their choices to incorporate maybe in the evening meal. Mealtime should be family time. You want to educate about healthy food selections when eating at restaurants. Encourage breakfast daily to promote better behavior and learning at school. You want to limit some of their favorite things like candy, chips, soda, fruit juice, and drinks. Encourage them to brush their teeth 2 times a day with fluorinated toothpaste and floss daily. Dental appointments should be twice yearly. For exercise, they should have at least 60 minutes over the course of each day. Physical activity, encourage them to go outside. For sleep, maintain regular nighttime routine and establish a regular bedtime routine. Limit stimulation before bedtime. So it's always great if you get into a pattern, maybe after dinner, where you have bath and then one-on-one time, maybe reading a book or quiet time, so that they can calm down prior to going to bed. And always good to get a set time so that they can get into a pattern. For 3 different age groups that we're going to address. First one is the 5 to 7-year-olds. They demonstrate gross motor skills such as hopping, skipping, and can tandem walk. They demonstrate balance coordination skills such as riding a bike, swimming, roller skating, and skateboarding. For fine motor skills, they are becoming masters at scissor skills, controlling pencils and crayons, and finger dexterity. They should be able to dress themselves, like tie knots, manage buttons and zippers. And this can be a little bit more cumbersome on your time to let them do it themselves, but that's the way they're going to master these skills. So let them do it. You can always supervise after they've tried to do the chore. They should demonstrate self-care skills such as combing hair and brushing teeth. Obviously, you should probably go back over their teeth a second time just to make sure that you've gotten all the debris out from their snack, dinner, breakfast. They demonstrate well-developed vocabulary and ability to follow directions. Receptive and expressive language skills continue to improve in this age group, and you should establish a dental home. For the 8 to 10-year-old group, children at this age show continued interest in school and learning. They communicate well with their teachers. You need to encourage them to be independent. Begin discussing body changes and using appropriate anatomical names. Praise their strengths. Establish a chore routine for them. In this age group, they begin to listen to others and use logic and reasoning. They begin to model responsible behaviors after others as well. For the 11 to 12-year-old group, puberty normally begins between 10 to 14 years of age. You want to discuss bodily changes for males and females. Also, with the females, you want to advise about starting their menstrual cycle. Introduce some of the products that they will be using so it's not so fearful when it does happen to them. Acne and body odor may become a concern for children due to increased sebaceous gland activity and hormonal changes. And if you haven't had children in this age group before, you will be impressed at their ability to generate body odor. Good hygiene practices should be emphasized. Understanding that some children may not practice good hygiene as a way to display independence. Parents should set expectations but also be flexible. Allow experimentation with self-expression, including hairstyles and color. One of the things that I saw a lot was mismatching clothes. My children want to wear different shoes on each foot, different socks. Within reason, let them display their personality. And hand-eye and coordination skills improve, and they will begin to start to express interest in playing musical instruments. and sports may develop or improve in this stage. The next stage is emotional well-being, and Kimberly is going to present that stage to you.
Thank you, Kim. We'll start by going over the emotional well-being and sexuality in each of the 3 age groups. The 5 to 7-year-olds, you want to encourage them to, or encourage yourself to listen to and respect the child and what they're trying to say. Show affection within the family unit. Encourage self-discipline and impulse control and praise their efforts. You want to encourage responsibility for their clothes, their toys, and good choice of foods. Discuss rules for dealing with all strangers. And to teach your child that private parts should only be examined by parents or their physician. Adults should never ask a child to touch the adult private part or keep secrets from their parents. For the 8 to 10-year-old group, you want to monitor for signs of early anxiety and depression. Encourage those open dialogues for expressions of the child's feelings. Always answer questions honestly in an age-appropriate manner, and help them to distinguish appropriate touch with the opposite sex in their same age group. You want to have an open dialogue regarding their questions about their bodies. This age group will still be inquisitive, but they'll remain immature in expressing questions towards their emerging sexual feelings. We need to help them to deal with failures in a positive way and encourage social activities on the child's terms and expectations and not to the parents to establish their own self-esteem. For the 11 and 12-year-olds, we need to praise their activities and achievements versus physical appearance in order to achieve a healthy self-image. Monitor for changes in behaviors, mood, and mental health. We will always want to explore different ways to cope with stress and anxiety with this age group especially. Always keep open lines of communication so that you don't create more barriers to where they will be less open to come to you. It's important that the child knows that they can come to their parent or another trusted adult or teacher if they have questions or feelings of sadness, irritability, anger, or loneliness. You should always ask open-ended questions. Do you ever get so sad or upset that you wish you weren't alive? According to the CDC, in 2014, the second leading cause of death for ages 10 to 14 was suicide. In 2013, suicide was the third leading cause of death for ages 10 to 14. Discuss expectations and values about dating, relationships, and sexual encounters. As children go through puberty, changes in sexual feelings and sexuality may occur. At this age, we should always encourage abstinence. For the social and academic, for the 5 and 7-year-olds, we should start preparing our child for school by discussing new friends and activities at school. Be really excited about going to school. We should tour and meet this child's teacher beforehand. Children demonstrate eagerness to learn and a natural curiosity and develop social interaction skills. From 5 to 7, we should always continue to read with and to your child. School expectations include impulse control, obeying rules, and getting along with others. Help with the management of anger and conflict resolution without violence. Biting, hitting, and kicking should not be allowed. At this age, they should develop ability to separate from the family without too much distress. They also demonstrate behavior modulation according to expectations from parents and society. For 8 to 10-year-olds, we need to help them to learn and distinguish social cues. This age group will begin to learn how to build, maintain, and end relationships. You should also offer guidance and support for healthy relationships. help them to communicate with adults more effectively, and begin to establish accepting the consequences of behaviors and actions. This age group begins to identify with perceived role models such as athletes and actors, establish good study habits such as quiet spaces, and be mindful of emerging learning disabilities or social anxiety through this age group. And also beginning towards the latter 10-year-old going into 11, 12-year-old, we're to expect pre-adolescent behaviors to begin. Definitely from the 11 to 12-year-old age group, we're to encourage their interest in extracurricular activities and get to know their friends. Allow them to explore different interests, include activities that involve training, commitment, and effort. Set clear boundaries for family responsibilities versus social obligations. Maintain family traditions. Establish rules and consequences. Play and work as a family to help the child learn to work well with classmates. We need to educate on nonviolent conflict management. Parents should be a role model. Talk about being bullied or stalked. Encourage the child to own responsibility in their schoolwork. Assist to prioritizing and organization. Encourage reading. Designate a quiet space for homework. And praise their positive effort in school. And now Kristen is going to go over risk reduction, violence, and injury prevention.
Thank you, Kim. So some of this is repeated throughout our whole anticipatory guidance video. One of the main things as far as risk reduction and injury prevention is to make sure that your child always wears their seatbelt, a helmet, a life jacket, or any other protective gear. It's really important to teach safety skills. In 2014, unintentional injuries such as drownings, falls, fires or burns, poisonings, suffocations, and any sort of transportation-related injury were the leading cause of death for ages 5 to 14. And transportation injuries were number one out of all those deaths, and that's from the CDC. Children younger than 13 are always safest of riding in the back seat of the car. You can use a booster seat or whatever is appropriate for their weight. Always encourage guns to not be stored in the home. In the South, we have a lot of hunters, and so a lot of people do have guns. So if you're going to have guns in your house, it's important to store an unloaded gun in one location and the ammunition in another location. One of the CDC's other facts that they have is that deaths from age 5 to 14 are the third leading cause of death is suicide by firearm. So it's another reason we really want to watch where those guns are stored and located. Another thing that's important is smoke and carbon monoxide detectors. Any sort of fire safety plans are important to have with children of all ages, so make sure you talk with your kid about what happens if a fire does happen. Is there a meeting spot in the front yard, like the mailbox? How do you get out of the house? All those types of things. It's important to keep matches and lighters out of reach of any age child. Another thing that you want to keep locked up is liquor or medications. Especially as a child is getting older, so the 11, 12, they're starting to become adolescents. They might start experimenting more or get peer pressure to sneak into the liquor cabinet. So it's really important to keep that locked up. And then for the younger children, they might see the colorful pills and think they're candy. So you want to keep them locked up. Another thing that will be emphasized greatly in this is that you monitor computer use, so chat rooms, social media sites, even not just computer but electronic device use, so iPads, cell phones. A lot of children have cell phones now, so you need to know who they're talking to, what they've been looking at on the internet. There are filters for internet sites, so it's important to make sure that you apply those filters so that you can kind of control what your kid's seeing. Another important thing is to know your child's friends. So it is more difficult because we have all the kids on the internet, so they don't know. So it's important to just look at their text messages, see what they're saying, see who they're talking to, meet their friends, see if they're good people. It's really important. Sunscreen is another important thing for risk reduction at a young age. Getting burned is really easily. Burns lead to skin cancer, so we always just emphasize that you start this early. Limiting exposure to tobacco smoke. So you've heard Kim even said this, the parents are the role model. So it's important that, if you don't want your kid to smoke, maybe you shouldn't smoke either. So be the role model. Don't be a smoker. They lead to all kind of upper respiratory infections for children, reactive airway disease. And then if they see you smoke, they're more likely to become a smoker as well. The other Kim also talked about your diet and being physically active. So according to the CDC, in 1980, obesity was 7% for the child and adolescent population, and then in 2012 it went to 18%. So more than 1/3 of children and adolescents are being considered overweight or obese. So really watch what they're eating and how much physical activity they get. So then we further break it down into the different age groups. So the 5 to 7 age group, we're going to be repetitive because we really want you to make sure you watch their internet and their social media exposure. We want you to teach your kids how to swim or enroll them in swimming lessons. Make sure that if your kids are around water, that you're with them, that you're watching them, that you want to make sure that they don't accidentally get into the water. Another important thing for the 5 to 7 age group is that you educate them about pedestrian traffic rules. So it's important that they look both ways when they cross the street. They know what the traffic signals mean. They hold hands. They do not cross the road unsupervised. This is also a good time to make sure your kid knows their address, know their telephone number, know how to get in touch with their parents if they get lost. Make sure they know how to find somebody to get them back home. So making sure that they know their address, telephone number, and that sort of information will help keep your kids safe too. And then seat belts. So 5 to 7 years old, the child may still be in some sort of booster seat depending on their weight. So it is important to make sure that they are positioned correctly in the booster seat, or if their weight is okay, that they wear in the seat belt appropriately. The next age group is 8 to 10 years old. So we want to start giving a little bit of independence with this age group. So it's important to kind of like let them do their own thing, but you also would like to make sure you watch them. So kids are kids and they're not going to know, and you're their parents. So make sure that you give them independence, but at a safe distance. It's important to know safety rules for home and school from strangers. So we don't want them to talk to strangers. And then we continue to emphasize our seat belts. We also like to start talking about appropriate friends for this age group. 8 to 10-year-olds will start hanging out with their friends more at parties and stuff like that, little get-togethers, and they'll have older siblings. So it's important to make sure that they are with children that are of appropriate age group. And then you do want to recognize all forms of bullying. If your child is sort of becoming withdrawn, that maybe there's some social things going on. Maybe they're getting bullied at school. If they don't want to go to school, or if they don't want to go to parties, whereas before they did, then maybe there's something going on and you should sort of question them about it. And then the 11 to 12-year-olds, this is starting to get some kids mature more than others. So this is starting to get sort of adolescent, late childhood. These are still considered school-age kids. So you want to make sure that you start the talk about tobacco, alcohol, drugs, and inhalants. It's important, once again, parents got to be the role model. So make sure that they know that it's not okay to do those things. Sniffing glue is not a good thing to do. It kills brain cells. Maybe you can get them on that notion, is you want your kids to be smart and you want them to want to be smart. Another thing is to deal with peer pressure. So that all kind of goes back along with the tobacco and the alcohol, is how to deal with peer pressure, how to say no. So those are important things. Another thing with peer pressure is with sex. So that 11 to 12-year-olds, those are in middle school, right? So sometimes middle schoolers start experimenting with sexual behaviors. They're having their period, so you want to start having those conversations Altogether, we do encourage abstinence, but sometimes you will have a child that needs to be educated on safe sex habits. You need to teach them about sexually transmitted infections and about pregnancy. If they're going to do it, then they need to be educated appropriately. And then another thing, once again, is internet activity and cyberbullying. We really, it happens a lot. You hear about kids that commit suicide because of that. One other thing is riding in cars with older siblings or other adults. You want to make sure if they feel unsafe that they don't ride in the car, and definitely don't ride in a car with anybody who is under the influence of drugs and alcohol. Our last little section we have is about red flags, and we break it down into the different age groups again. So the 5 to 7-year-olds, if they're unable to sit still, focus, obey rules in class, if they're unable to read phrases or are having language difficulties, if they cannot copy a square or diamond or print their name, those would be red flags. The 8 to 10-year-old, if they lack hobbies or friends, they have a flat affect, you'll be worried about depression, poor peer influence, they lack operational thinking, unable to perform basic math skills, unable to tie their shoes, or they demonstrate a problem with following through with verbal instructions. And then the last age group is the 11 to 12-year-olds. Some of their red flags would be those risk-taking behaviors, which are smoking, alcohol, having sex, or inappropriate sexual behaviors, animal cruelty, intentional fire setting, defiant and rebellious attitudes, flat affect again for depression, and then if they're having difficulty in school with reading and comprehension, writing, and lack of organization, those would all be your red flags. Thank you for watching our video. We hope that you enjoyed it. If you need any further resources, you can always go to the CDC, or you can do Bright Futures Guidelines for Health Supervision of Infants, Children, and Adolescents. Has great information. Thank you. Bye.